lot of satisfaction. ये जो seat 96, 97 में आप लोगों के दिमाग में आया होगा. And coming back to India and doing otherwise of US में you could have led a very successful and peaceful life there.
Yes.
Working, you know.
Yes.
Because at that time US was far developed than what India is, you know.
Yes. That time,
Now,
everyone had a dream कि मैं USA
Yes,
जाके
okay.
वहाँ settle down हो जाऊँ.
बट आप इंडिया वापस आए और
Yes.
फिर विद द कॉज एंड वो कॉज आज एक कितना बड़ा रूप ले चुका है
Yes.
कि सो मेनी डॉक्टर्स आर गेटिंग एसोसिएटेड एंड दिस इज रियली ब्रिंगिंग क्वालिटी हेल्थ केयर और डायबिटिक फुट केयर क्वालिटी डायबिटिक फुट केयर टू people who are suffering from diabetes.
Yeah.
And eventually if you see last 10 years 12 years diabetes is growing at a phenomenal pace.
Absolutely.
You know?
Absolutely.
So diabetic foot will definitely have a larger chunk. What do you say on that? Like how many patients who are diabetic are at really having diabetic foot? What's your analysis on clinical practice or some data if you have?
Yeah, sir, around about 40% of all diabetic patients, suppose a doctor is seeing 100 diabetic patients, a physician or a diabetologist, 40 out of those 100 will have some foot problems.
Okay.
40, that's a huge amount, huge number of patients.
Yes.
Out of those 40%, 25%, that is something around 10 out of those 40 patients or 12 out of those 40 patients will have a frank diabetic foot ulcer.
Okay.
Ulcer means a wound on the foot. Whether that wound is because of neuropathy, some trauma on the foot, or because of the gangrene, he has developed that. So they are, if you look at the total data of about 70 to 80 million people, and these million people have 2 feet.
Right.
So this shows about 160 million feet are there in the country suffering with this. So many 25% out of these 160 million feet
Right.
will have diabetic foot ulcer.
Oh.
So if you look at a financial model also for diabetic foot is a big branch.
Right.
Suppose a diabetologist is there, he's seeing only a patient of for sugar and insulin and all. Now when we give them education and give him training for this podiatry and he does some diabetic foot care procedures, it's an incoming to his clinic. He are doing along with physician, it's only the consultation. He is doing small procedures, he is giving them soles, sheets, some dressing gels or hydrogels and lot of things are available. He is giving them proper footwear, shoes, and then he has this PRP therapy, VAC therapy, hyperbaric oxygen therapy, topical oxygen therapy. So a lot of therapies are also involved in this. So over a period of 2 to 3 years, his clinic develops into a diabetic foot care center.
Right.
So it's a good financial model also for the doctor. As well, if we identify a doctor in a smaller town and give him diabetic foot care training,
Right.
in say 3 to 4 years, we have people like this in IPA.
Right.
Within 3 to 4 years, he start getting referrals from something around 100 to 200 kilometers around his area.
Okay.
So diabetic foot is something where every doctor doesn't want to put his hand in it because there are smelly wounds,
Right.
there are a lot of dressings are involved. So you need your paramedics also.
Right.
You need a male nurse to do dressing. Doctor himself will not do the dressing.
Right.
Or if he has opened his dressing, then you need a staff to help him in the dressing, like you see in my center here.
Right.
So you need your staff also. Like you have to add something in the shoe, you have to give them a chappal or a diabetic sandal. You need a staff.
Right.
And your staff should be trained enough.
Right. So
So
do you do training of these staff?
yes, in IPA we have a special training for the doctor as well as a paramedic.
Oh, that's
Ah.
nice.
So when we call these doctors for our workshops, we tell them to bring one of their paramedic also along with it, because paramedic or male nurse, female nurse or diabetes educator, they are the good people to cut the nails of the patient. Because patient teach them how to cut the nails, remove the dead skin, remove some calluses, corns like these. So small procedure a paramedic can also do. So this is very good for these diabetic patients. So diabetic foot care is diabetic foot patients are increasing.
Okay.
Also, I'll just let you know, there have been a research from All India Institute recently, about 5 years back. They have done something around 60,000 children in Delhi.
Okay.
They took from about 7 to 8 schools, government schools and private schools. They found out that children from class 7th to 12th, 40% of these children were over the level of obesity
Okay.
for their height, BMI. The BMI according to the weight, according to the height of the children was high. So 40% of our school children are
At risk of
obese.
diabetes.
With obesity, they are risk for diabetes, risk for blood pressure, hypertension, risk for coronary artery
As they
disease.
grow old.
As they grow old. Similarly, if you look at the data of India and even for US, like 15% of our population is getting type 1 diabetes.
Right.
15%, right? That is school-going children. So this is a population, school-going children, which turn into a frank diabetes later on.
Oh.
Because complication of diabetes like dialysis when they have renal failure,
Right.
diabetic foot ulcers, coronary artery disease, तो type 1 बच्चों में ज़्यादा होता है ये. So that's why we are having large number of diabetic patients in the country who are suffering with complications.
Right.
So these are also very important thing to keep
Right.
in mind that our young generation is getting diabetic. People in 30s and 40s are getting diabetes. So by the time they are 50s and 60s, the age, they will develop these complications.
Right.
So more diabetic foot care centers are needed in the country if we have to save these patients from amputation. So that is the goal of Indian Podiatry Association, and that we are working on.
So you are facilitating basically कि ज़्यादा से ज़्यादा लोगों तक डॉक्टर्स के द्वारा ट्रीटमेंट पहुँचे
Yes.
या जो उसको नॉलेज रखते हैं. And sir, yesterday we were talking about something called FDFM. So that time you were saying that it can bring employment to people who are either paramedic or they have graduated in biology.
Yes.
So I couldn't get it. So because is IPA only for doctors or you have a wider spectrum?
सर FDFM जो हमारा प्रोग्राम है, दिस इज अ फेलोशिप इन डायबिटिक फुट मैनेजमेंट. ये अभी तो मेनली डॉक्टर्स के लिए है, MBBS एंड अबव
Okay.
डॉक्टर्स के लिए. बट एनी स्टूडेंट, बायोलॉजी स्टूडेंट who want to enter into this,
Right.
if he has to get BSc, the basic degree is BSc in podiatry.
Okay.
That we are now joined with Northampton University,
Oh.
and we are developing a BSc podiatry branch in Manipal University.
Okay.
In Manipal. So Northampton University and IPA and Manipal University, three associations have joined, and we are developing a BSc 4 years degree course in Manipal.
Okay.
So no student of biology after 12, like people go for MBBS or they go for BDS, they can enter into podiatry. They can do that course. FDFM is for the doctors who are busy in practice, but they don't have any degree or any education in the podiatry. Those doctors can be take up FDFM course, and that certificate is now given by Indian Podiatry Association and Northampton University. Coming down to your second question, for the general public, also we have recently launched these. We have got a tie-up with Google,
Okay.
and we are doing this Google broadcast channels,
Okay.
where any of our IPA members can have these channels. They can have their recorded channels,
Okay.
and that channel will be as people are booking on Zomato, they are booking air tickets. So they have they'll get a Google pop-up.
Oh.
So a doctor, suppose doctor is in Pune, so he has his Google channel done. All his activities will be available on the Google channel.
Okay.
He'll put his education in his local language, like you can put in Tamil language, you can do it in Punjabi, Haryanvi, Maharashtra, local language you can put it. And any patient can have it on his phone, and all doctors education on diabetic foot care, on diabetes, on renal disease, on eye disease, kidney disease,
They can view it.
they can go to general public, they can listen to on their phones.
That's really nice.
So 500 channels Google has allotted to IPA members.
Okay.
So that also we are working on now.